pleasure to be with you all. I am really excited about the opportunity to share my love for giving the gift of hospice by giving this presentation. So I am going to share my screen. Get my PowerPoint up. And okay. Okay, there we go. So again, thank you for having me. My name is Angelica Reid, and I'm the Patient Access Manager here at Angela Hospice in our intake department where we process our hospice referrals. And so today I'm going to talk to you a little bit about navigating the hospice journey. So choosing hospice care, it can be a very overwhelming and emotional experience. There can be many unknowns. Every person's journey is unique. There are many factors to consider when choosing hospice care. And so overall, it can be a tough journey to navigate. But being educated about hospice and getting the proper support can make navigating the hospice journey easier, and it can truly make receiving hospice care a gift. So I just like to start off with my objectives for the presentation or what I hope to accomplish. I would like to explain what hospice is and how to access care. I'm going to address some common misconceptions about hospice. I plan to describe the hospice journey and what to expect during that journey, and also to provide education about some resources that are available for support. So I would just like to start off with a moment to reflect. I would just like everybody to think about a time where you or a loved one, a friend or a family member, maybe a patient or a client of yours received bad news from a provider. And that conversation may have went something like, I'm sorry, there's nothing more we can do, or there are no more treatment options, or the prognosis is poor and you have 6 months or less to live. And they may have concluded that conversation at some point by saying, you may want to consider hospice, or hospice may be the best option. And so this may be the first time that that individual was hearing the word hospice. And so I think that this is the moment, this very moment is the beginning of the hospice journey. Hearing the word hospice can trigger a lot of thoughts and a lot of emotions. And much like this slide, we can become overwhelmed with these thoughts and emotions. And so at that moment, when we hear hospice, we start to think, well, what's next? Who do we call? How do we sign on to hospice services? Or, do we have to stop treatment? Or how long will we need hospice, and who will be there to provide this care? But at the center of all of our thoughts and feelings when we hear the word hospice, at the center of it all is the question, well, what is hospice? So the gift of hospice. Hospice is specialized care for the terminally ill. It seeks to empower patients to carry on alert and pain-free lives. It seeks to promote dignity and to maximize the quality of life. So hospice focuses on living rather than dying. So hospice care truly allows the patient to live the rest of their lives fully and as comfortably as possible. So I want to talk about some common misconceptions about hospice. If you ask 10 different people what hospice was, you may get 10 different answers and 10 more different perspectives. And these are based off of their personal experiences or experience that people they know or loved ones have had with hospice, or it may be based off of what they think they know about hospice. And so this is where some of these common misconceptions are birthed. So a common misconception about hospice is that hospice is a place where people go to die. So before I became a hospice nurse and taking care of hospice patients, I actually thought that. I thought that hospice was a place and that I could apply to a hospice job, that this was a place. But in fact, hospice is really a type of care that can be provided in many settings. And so it's a place where we can provide support during end of life, and it can be given in various settings. And we'll talk about some of the settings that hospice can be provided in shortly. Another common misconception about hospice care is that it is for cancer patients. And actually, hospice care is for any terminal illness as determined by a physician. Any incurable disease or disease process can receive hospice care. So it is not just for cancer patients, but it's for an array of terminal illnesses and incurable diseases. Another common misconception about hospice is that hospice is for when you have given up hope. Many people believe that hospice is the end. That's what makes hearing the word hospice so scary, because it means that, well, this is the end. This is the end of the road. We no longer want to continue fighting. We're giving up. But in fact, hospice can truly redefine hope by helping patients to find peace and to be able to enjoy the rest of their lives with their loved ones and in a way that is pleasing to them. Another common misconception, hospice hastens death. When actually research has shown that those who receive hospice care may actually live longer than those who do not receive hospice care, because the focus truly is on living and on maximizing the quality of life. And so many people believe that if they or their loved ones sign on to hospice, that they will die sooner. And that is a misconception. And lastly, a common misconception is that hospice provides around-the-clock care. And actually, hospice staff, they support patients and families to provide hospice care to their loved ones. So hospice truly is a support. It is a support. There are instances where hospice care can be provided around the clock, and I will highlight one of those examples later on in the presentation. But truly, hospice is a support for patients and families who need this care. So it's not necessarily around the clock care, but it is a support system for those that need it. So since we know now that hospice is not a place, but rather a type of care that can be provided in many settings, I wanted to just talk about where hospice care can be provided. So hospice care can be provided in the home. It can be provided in the home of the patient or a family member or a friend, or wherever that person considers to be home, wherever they're comfortable is where hospice care can be provided. Hospice care can also be provided in nursing homes and long-term care facilities. So if you have a loved one who lives in a nursing home, they can be provided hospice care in that setting. Hospice care can also be provided in an inpatient hospice center. And I'll talk a little bit more about our care center later in the presentation. And care can also be provided in group homes and assisted living facilities. So I think this really just speaks to the fact that hospice is not a place, but that this care can be provided in many different settings. And this is a common question that comes up as people are starting the hospice journey is, do we have to come into the hospital, or is there a place where we need a specific place where we need to reside? And so I always like to talk about where we can provide care. Another common concern as the hospice journey begins is how is hospice care paid for? And there are some different options. So hospice is covered by most private insurers. So that would be your insurance company or who you have health insurance through. Hospice is covered by Medicare under the hospice benefit. So it would cover hospice services except room and board if you were living in a facility. So the example I gave about receiving hospice care in a nursing facility, for example, hospice services would be covered by Medicare, but they would not actually cover the living expense, the room and the board. And then hospice care can also be covered, paid for through private pay or out of pocket. And so there will always be insurance individuals and billing professionals who can help provide support and guidance in terms of what is the best option for paying for hospice care for the individual and their family. So what does hospice care include? So hospice care includes pain control and symptom management. There is a lot of focus in hospice on pain control and symptom management because the goal is to provide comfort and to maximize quality of life. And so we individualize care plans in hospice that are really focused on making sure that the individual is comfortable and that they feel their best, that they can feel. So pain control and symptom management is a big focus included in hospice care. Also medication equipment. I often get questions about, medications. Well, are medications covered? Are they included? What about medical equipment? Medications that are used to control pain and control and to manage symptoms are included in hospice care, as well as any equipment that may be needed, such as a hospital bed. So those things would be included in hospice care. There's also assistance. So if the patient, you or your loved one needs assistance, for example, with bathing, that is included in hospice care. Also, caregiver training is included. I mentioned before that hospice really is a support. It's a support where we provide education and tools and resources that enable the patient and their family to be able to provide hospice care in the setting of their choice. Also, we provide support in exploring resources for additional care needs. So for example, if you need more support in the home with meals or laundry or errands and that's included, being able to coordinate resources with you to get the additional help that you need while receiving hospice care. Emotional and spiritual support is a major component of hospice care. It can be a very emotional experience. And so we like to make sure that all of those needs are being addressed and being met. And so whether that's through social work, whether that's through the spiritual care team, there's a lot of support for emotional and spiritual needs included in hospice care. While under hospice care, you get a hospice care team. So a multidisciplinary team of physicians, providers, nurses, hospice aides, volunteers, social workers, spiritual care that are all there as a part of that customized treatment plan to address any needs that you have while you or your loved one are receiving hospice care. So our hospice care team is a part of hospice care. And bereavement services. So hospice care just does not end when the patient passes, but even after additional support or for family or friends or those who were involved into care, they have access to those support services as well. And I'll talk a little bit more about them towards the end of the presentation. So now that we have an understanding of what hospice is and what are some of the common concerns and questions, I want to talk a little bit more about how Angela Hospice can support you or your loved one through the hospice journey. So getting started, sometimes the hardest part of the journey can be making the initial phone call. So we can receive referrals and inquiries from a number of different people, providers, social workers, case managers, the patient, or even a family member can initiate contact to gain access to hospice services. Those contacts come in a variety of ways. Sometimes it's a phone call or maybe a fax from a physician, or even email. Sometimes calling and talking about it is difficult to do at that time. And so often people will just email and say, can I get some more information, or here's my situation. Can I get some guidance here? And we would assist in getting you get access to hospice services. So on the receiving end of that initial call, fax, or email is our Angela Hospice Call Center. This is where our team of experienced hospice professionals will answer any questions that you have about hospice services. So maybe after speaking with your physician and they say, you may want to consider hospice, you may have a wealth of other questions that you may have and want answered. And so here in our call center at Angela Hospice, we can answer those questions that you have about hospice. And even if there are clinical questions, sometimes there are case-specific questions that you may have, you or your loved ones, about that specific situation. And if it's a clinical question, that can come over to myself or to one of our nurses to answer those questions and get further clarification. Our call center will also provide support and guidance about next steps. Sometimes it's, well, what do we do next? Or where do we go from here? And so we provide that support and guidance in terms of where to go next. And finally, if you or your loved one decide that hospice is a good fit and that this is the direction that we want to go, we assist with helping to schedule a hospice admission so that you can start hospice services. So what happens during a hospice admission? So hospice admission would be once you decide that you do want services, and so that you want to schedule an appointment to start hospice care services. So what that looks like is that you would get a visit from a hospice nurse who would come out, and they would talk to you a little bit about hospice services. They would get to know you, your family, your loved one, the patient, to get an understanding of what your needs are and what your goals are in terms of care. During that visit, the nurse would address any immediate concerns that the patient may have. Often pain is an immediate concern that is brought up during an admission visit. And so there will be an opportunity to address immediate needs during that time. That would also be the time when we would initiate a plan of care. So really we would look at what the goals are. So is it to manage pain? Is it to maximize, comfort or maximize independence? So at that time, we would establish what this plan of care looked like, so that hospice nurse would collaborate with a provider and discuss medications, equipment that the patient may need, and what the plan of care would look like to get started. And then they would also provide supplies and whatever's necessary to get hospice care started during that admission. So what happens after a hospice admission? So the hospice nurse has come out, you're now being admitted to hospice services. So what is next? So next you would meet your hospice care team. You would get an opportunity to meet your nurse, you would get to meet your social worker and other members that are a part of your care team. They would go over the plan of care with you. They would set up a schedule for how they would visit. And they would really customize this care and this schedule based off the needs of the patient and what they need. There would be ongoing support and education regarding decline in hospice care, and that would happen throughout the hospice journey or as long as hospice services are needed. And there will be a lot of planning and anticipating needs. And so in this phase, there's a lot of education about what's next, what to expect, what can we expect to see happen during various phases of the dying process. So this was something that our clinicians would support and guide the patient and family while on hospice services. And so support at end of life. So there is no predetermined amount of time that a patient can remain on hospice. But at some point, it is inevitable where death is imminent. And so I just want to talk a little bit about the support that is provided at end of life. So we have 24/7 triage nurses that are available to support in terms of, symptom management, pain, and educating the patient and their loved ones on what's next. What are we seeing and how can we manage this? On-call nurses for symptom management in crises. So nurses to come out and support and assist with care when things change. Spiritual care is also available to help address any spiritual or emotional needs at end of life. Because it can become overwhelming. A lot can be happening during that time. And so, having that good support is very important. And then we also have the option of the general inpatient care here at our Angela Hospice Care Center. And I'll talk a little bit about that. So the Angela Hospice Care Center is a home-like alternative for hospice care. This is a place where around-the-clock care can be given to address pain and symptom management issues at end of life. The hospice care team is there on site to address all care needs in comparison to when we talked earlier about the hospice care team coming to wherever care would be given. In this instance, the care team would be there available all the time to be able to provide support in hospice care. And eligibility for a care center is to be determined by the hospice care team. So after the dying process, one of the most important parts of the hospice journey is grief care. And so the hospice journey does not just stop after the patient passes away. It's necessary to provide support and encouragement to patients, family, and friends that they leave behind. And so here at Angela Hospice, we support our patients' families and loved ones with grief support and counseling. We do have grief support groups, and we have grief support for children. Children grieve differently than adults. And so we have specialized grief support and care aimed at meeting their specific needs. And so to bring it all together, I just wanted to end with this quote that I stumbled upon that I felt really speaks to the hospice philosophy. And it's that you can't give your life more time, so give the time you have left more life. Thank you. And I will turn it back over to Jennifer.
Thank you so much, Angelica. I appreciate everything you shared with us today. This is an opportunity now. Angelica is available for question and answers. You can unmute yourself and ask Angelica the direct question, or if you prefer, you can put it in chat. I will then share it with Angelica. But at this time, we will open the floor up for any question and answers from anyone in particular that you'd like to address to Angelica. So the floor is yours now, folks. Angelica, there seems to be a couple coming in on chat here. One came directly to me, and they would like to know when they begin the process, how long after they make the initial phone call into the call center could they start the process of getting their loved one into Angela Hospice Care?
So that's a really great question. So after making the initial phone call, our goal is to touch bases the same day. We initiate contact the same day to let the patient or family member know, we received this referral. to get an idea of if they have questions. And then we like to proceed with scheduling and admission. Our goal is to get an admission scheduled within 24 hours, and that's not always consistent, but we initiate contact and begin the process right away at the point of the phone call.
Excellent. Thank you so much. Excuse me. Again, folks, you can unmute yourself and ask Angelica a direct question, or as some people are doing, you can put the question in the chat. One of the questions, Angelica, and I'm pretty sure that I can answer this one, is they've asked if they could get a copy of the slides. As we mentioned at the beginning of this program, the recording will be available on askforangela.com by the end of the week. We will have that posted for everyone, as well as previous Angela answers are also posted on this site as well. So you can look for that, and that will give you some information, as well as, I don't know if Angelica, if you wanted to share, particularly if somebody wanted to contact you, the slides, or again, it's always available on a recorded, which is available at Angela Hospice.
Yeah.
Oh, go ahead. Sorry, go ahead.
No, that's what I was just gonna say. It'll be up there. I think they stay up there too. So
yes, exactly. Any other direct questions for Angelica? This is your opportunity now. Angelica is one of our leaders here at Angela Hospice and is available to answer your direct questions, whether you are curious or concerned or something that she didn't necessarily cover in the presentation, or if you would like to have her answer something that prompted your thought discussion based on her presentation. Now is your time to answer the questions.
Hi, Angelica, how are you?
Hi.
I wanted to ask a question. If does a person have to be in the hospice program to receive resources from you concerning helping a child or an adult during a time of grief? Okay.
No, they do not. They don't have to be a part of the hospice program. And even if it's just questions about outside resources, we get calls into the call center sometimes about, just resources. And sometimes people think that they're looking for hospice care, but maybe they're looking for caregivers in that. And so we do offer assistance and provide help with resources. And you don't have to be on the hospice program at all.
Thank you. Thank you so much.
You're welcome.
Angelica is exactly correct. In addition to the process and the resources that are available in getting information about hospice, Angela Hospice has a terrific grief and bereavement program. That those services are also available to people in the community at no charge at any time, and you don't have to have had services rendered by Angela Hospice. They can still participate in our support groups. They can participate in our grief support groups. I encourage you to go on to our website if people have questions about when they meet. Some are meeting still virtually and some are transitioning back into face-to-face. But again, these resources, as Angelica mentioned earlier, are also included in our services that we offer and resources that are available to you and your loved ones at this time. I don't believe there are any other questions, but I will wrap up. I will begin to wrap up at this point. And, Renita, did you have a question? It looks like you raised your hand.
I just wanted for her to reiterate, is there a period of time like the end of life? I understood it was like 6 months, 180 days in order to, for hospice to come in. Is that true or not true?
So one more time, I'm sorry. I just want to
in order to receive hospice services, is it 180 days or less, or did you say an indefinite period of time?
So the prognosis, it varies. There is no definite amount of time. There's no pre-decided amount of time as far as prognosis. There are many things that are looked at when considering eligibility. Prognosis is just one of them, but definitely looking at, changes and decline in the last, certain period of time. There's no predetermined amount of time that you have to have been given for prognosis. That was really just an example that I was using because it's a common one that physicians will use. They will say, 6 months or less, or 3 months or less, but it varies.
All right, thank you.
Mm-hmm.
Excellent. Thank you so much, Angelica and Renita, for asking the question. Just give you another opportunity to ask any questions, and while you're thinking or typing, I'll remind you of our next Angela Answers, which will be October 19th, and it's how to leave a legacy. And that will be October 19th at 1 o'clock. Again, we will be posting the information and sending out information leading up to that, but you can register via our website at any time. And at this time, before we let Angelica go back to her critical work that she does here at Angela, is there any other questions or concerns? While you're thinking of those, just remember that this recording and other recordings for Angela Hospice are available, Angela Answers are available on our Ask for Angela or angelahospice.org website. And you can reach out to us at any time. Again, Angelica, thanks so much for joining us today. It was a very beneficial opportunity to learn and get questions answered. And at this time, I'm going to wish everyone a fabulous afternoon, and we'll look forward to seeing you on October 19th at 1 o'clock for How to Leave a Legacy. Thanks so much, everyone. Have a great afternoon.
Thank you. Bye.